Hello, I'm Dean McKnight, and welcome to another edition of Taking Back Our Neighborhoods, a community outreach program of Operation Our Town. Operation Our Town is a very special organization. I want to share their mission statement with you. Operation Our Town's mission is to facilitate the partnerships between community and business, to fight drugs and use of crime through proven law enforcement treatment and prevention techniques. Joining me now is Judy Rosser, and she's going to talk about some subjects this morning I think you'll find interesting. Judy, welcome.
Thank you for having me here, Dean.
And tell me about how your organization got started. When did it get started?
Well, actually, substance abuse, alcohol, and drug use is not a new thing. It's been for centuries in our communities. But back in 1972, in the state of Pennsylvania, they actually developed an act that organized substance prevention, intervention, and treatment under an advisory council. With that act came an appropriation for funding finally to help treat and prevent substance use in our communities. They were located under the Department of Health, and with that, the Department of Health was what they call the state single authority, which received all the federal funds for drugs and alcohol at that time. What they did, though, they knew that they couldn't manage all the funding for every community in our Commonwealth, so what they did was set up state single county authorities then, where they actually identified an agency in the community, and it can be organized in different ways, and each county can decide which way they want to organize it. And up till about July of this year, it's always been under the county government. Drugs and Alcohol Office was part of the mental health, mental retardation program. And from there, we were charged with assessing our community, planning, working with community partners, and providing a full continuum of services, which included prevention, intervention, and treatment.
That's terrific. Sounds like you've had a great history.
Well, it's been good that there's been attention to the issue, because as the years have gone on, as we've seen, substance use, alcohol is pretty constant in our community, and it's still the #1 drug of choice in our community. But what we've seen are the drugs that have changed, especially going into the 80s. We had an epidemic of cocaine use, and then here starting in the mid-90s and through 2000 now, we've seen opiates, and then we've also, which include heroin. And now what we're seeing is the trend of prescription drugs, because at the same time that these drugs, the street drugs, were coming along, pharmaceutical drugs were being developed to address needed interventions and diseases in our communities, high blood pressure, seizure disorders, pain management. So those medications were also being developed, and as these two things came together, we've got a perfect storm almost, because now in our community we have an opiate using population, and we have very strong opiate prescription drugs that are available now in our community and are being diverted. So it's a very scary situation.
It sounds like a really challenging role that you play, and specifically those are the things that would cause somebody to seek help with your organization?
Absolutely. Luckily, we don't do it alone. Operation Our Town is a primary example of how a community can come together and really start addressing this issue. As far as what we do, that's one of our primary focuses, is we assess what the needs are, but then we look at how can we address it. And typically that is through community partnerships. We try to bring other people to the table to help us, because there is no one fix for this issue. Just like there's no one reason people start to use substances, there's no one way that we can address it. We have to really look at our schools, our communities, the environment that our children are living in, and what is our community, what is our feelings and positions on, youth use of alcohol or tobacco and other drugs. So it's been a very complicated issue to address.
Judy, it sounds like if I were to call you, you would design a specific treatment for my personal problem. Is that what you're saying?
That's correct. What we have available for anyone who's seeking help, they can call to our office at the Blair County Drug and Alcohol Program, or they can call Contact Altoona, who has a list of all of our licensed drug and alcohol treatment programs, and my office will actually fund for a free assessment for them so that they can be evaluated, see how severe their substance use is, and then from there we evaluate if they're eligible for the funding that we manage. We could even possibly have funding available for their treatment services then.
Wow. And how would this process take place? If I made my initial phone call, then what happens?
What happens is, whether it's our program or any of the licensed treatment providers, we try to get them in within 7 to 10 days into assessment. And in that assessment, it takes about an hour to an hour and a half, but it's a pretty thorough biopsychosocial review of what's been going on with their substance use, when they started, what things have happened in their life that's been impacted by their use. Is there a progression of use? What we're trying to see is how severe their usage is. We also look at the types of substance they're using and whether they're going to need some type of medical detoxification, because some drugs coming off them, you have to be medically monitored while you're coming off of them, because there is risk of seizures or even, depending on how chronic their use is, even death if you just would stop that drug. So we really look at that. We take that very serious, and we try to make sure that we're getting them to that next step, because even though some people come in saying, yeah, they want help, making that next step to say, yeah, I'm going to do this is hard. So we're trying to develop a relationship in this interview that engages them and helps them understand they need to make that next step to get some help.
It's interesting that you mentioned the medical side, because I'm certainly at an advanced age, and I realized I never thought people my age would have drug problems or the inability to handle their medicines, but apparently they do. And when you go through this, do they have to do it alone, or do family and friends help? What role would my family play if I was having a problem?
Well, your family can have be involved with the treatment process, but you would have to want them to be able to do that. In the state of Pennsylvania and across the state, anyone receiving drug and alcohol treatment that have a certain level of confidentiality available. So anybody who would want to be part of that treatment experience with them, come to a family session, you would have to give them permission, that treatment provider permission, to allow them to be part of that, to come in, do some family sessions, and help to work through it, because you're right, it is a family disease. Families are very much impacted as they see somebody starting to spiral out of control with drug use. They're just as much impacted by it. They find themselves not being able to sleep, being affected, depressed. They find themselves not knowing who to turn to. We do have a support group that meets weekly for family members. It's called HOPE. And it meets every Wednesday night at 7 o'clock. We have a counselor who facilitates that. It's about an hour and a half group, and it's open to family and friends of people who are addicted. And that meets at Crossroads, which is right across from the Pennsylvania Department of Transportation Driving License Center. It's right across the street from them. So we recognize also that even if the individual doesn't want that family member involved, that it's very important that family members also seek out help to help them know how to get well, because they become very sick too by the disease.
I hear the term used, enablers. And if I were a family member, perhaps without even knowing it, I would be an enabler. And you're saying that these classes would help me understand what my role is in this treatment.
Absolutely. They would give you some tools that you can use, and it also starts challenging for you to say, what can I live with and what can't I live with? Some people may continue to want to say, I won't throw them out on the street because that's not something I can do, but I can do these other things. Or others will say they can't live in my home if they're going to use drugs and alcohol, and that's what I can do. And these classes help you start to get enough information so that you can start making those decisions about how you can and won't allow it to continue in your life.
So the educational process plays a big role in this.
Absolutely.
For all of us.
All of us, for communities to understand, about the disease of addiction and how to prevent it and how to address it, but also for the individual themselves that's addicted. Education's unbelievable. A lot of people don't even understand, who are in the disease, how much of a brain disorder it is and how much their substance use has changed and altered the brain chemistry, and that's why it is considered a disease.
I will have to say, since the formulation of the Our Town group, I myself have become more educated in what my role is in just as a community member. Whether or not you have a problem, we have a problem. And I'm a part of it, and I need to do my share to take care of it. What separates you from other groups, Judy? I hear a lot of different names bantied about, but what makes your group separate?
Our role in the community as the Drug and Alcohol Program and being the single county authority, it is to really assess the needs of the community and then plan for services in the community. We receive all the state and federal funding from the state allocations and from the state authority, and it is our responsibility to make sure there's a continuum of services available throughout the year. We run on a state fiscal year, so we're responsible to make sure those things are available, that assessment services are available, and at some level, at least depending on funding, because funding keeps getting cut, that we have services available throughout the year. But it's getting tougher as we see the funds being reduced. The volume of people coming to our door still is very high. We, in our agency alone, with the funding that I have, the public funds that I address, I serve about 1,200 people a year, and that's just in treatment. That doesn't count what I serve in prevention services, because we provide interventions groups at the schools. A lot of people don't think the schools are doing enough, but there are a lot of things going on at the school level right now. There are more educational pieces we could be doing, but as far as intervening on kids, there's student assistance programs that are available, and we make sure that we have services available. So that's one of the things that my office is responsible for, is making sure that those services are happening and helping with that. We also have the training. We're certified by the state to do the training for the student assistance teams, which anybody sitting on those teams in the school, what happens is if a child's having problems, a teacher can make a referral to this team. They review those referrals, and we have professionals that are sitting at the table. We have treatment, mental health, and drug and alcohol treatment people there. We have preventionists there, and depending on that, whether that child needs to be seen by a mental health or a DNA counselor, or if they don't think there's an issue yet, they may go into one of our intervention groups. So there's a lot of things going on right now in our schools. So that would be one example of what we're responsible for planning at my organization.
I'm sure there must be some stigma attached to having a family member who's seeking treatment or who needs treatment. How do you do the confidentiality side of this? Is there confidentiality for family members?
Oh, absolutely. Anybody who calls any of the drug and alcohol treatment programs or to our office, that call is confidential. We cannot release that information to anybody. If somebody comes in and seeks an assessment, we can't let anybody know that that person was there for the assessment unless they've signed a release for it. So yeah, the confidentiality is very important.
And Judy, at this point, I guess I have to ask the community again. Operation Our Town is funded by the community, and
that's great.
Tell me about the role they play in funding you, and how important it is that everybody gets involved in this. As I said earlier, this isn't a they problem; it's a we problem.
That's correct.
How do we help through Operation Our Town?
Okay. Well, we applied for a grant last year, beginning of this year, with Operation Our Town, and the grant specifically was to look at the relationship between our system, the drug and alcohol system, and our physicians. And so what we wanted to fund was one of the staff people that I have, it's called a case manager. She actually works with individuals to help them get into the supports that they need outside of drug and alcohol treatment. A lot of these people have a lot of other issues when they come to the door. They have legal problems, they have housing issues, they may have mental health, undiagnosed mental health issues that we need to help coordinate services for. And what we wanted to do with this grant is start to work with the physicians specifically who are providing medicated assisted treatment for our opiate users. It's called buprenorphine. It's the drug that's allowed. It was back in 2002, the federal government approved physicians to be able to prescribe this medication to opiate users to help address some of the opiate issues we have in not only our community but nationally. So physicians could actually start getting involved in the treatment of opiate abusing individuals. What was supposed to happen with that is they were supposed to also be referring them for treatment, not just providing a medication, but also there's a behavioral component. That was addressing the physiological component of the dependency issue, but there is a behavioral component that needs to be addressed also, and that's through treatment. So what we're trying to do with this grant is to have a point person who goes and develops those relationships with the physicians and helps work with it, because there are some mandates that have come down from the state that says now that they cannot authorize the medication unless there's also treatment going on. So we want to be that person that's going to help them coordinate that service and ensure that treatment's happening for these people, that drug testing's happening with them, that the physician's getting the reports back from treatment, so that there's a good connection between treatment and the physicians with these individuals.
Judy, tell me in a couple minutes, how did you get involved in this? This must be a terrific personal commitment.
Well, I've been involved with the system professionally for over 23 years, 24 years now. But personally, I live, addiction has been in and out of my life for a long time, through family members and even myself in recovery. So that's probably where God's led me. I just got into a job at Coforge over 24 years ago. And I've been in recovery for that long, and as I've gone on with my own profession, I've professionally moved up into where I'm at today. So I really believe God's led me where I'm at, and He's been a big part of what I've done.
What a wonderful commitment, and the community's lucky to have you. Yeah. You're a wonderful person. Thank you.
Well, thank you, Dean.
Ladies and gentlemen, we've been talking to Judy Rosser. Judy is with the Drug and Alcohol Treatment Center, and one of the people in our community that probably goes less rewarded than she should be, and certainly deserves applause. Judy, you're a terrific asset. Thank you.
Well, thank you very much, sir.
Be a good neighbor at Mainline National Bank. That means helping a neighbor with their business, home, or child's future. For Operation Our Town, it means eliminating drugs and crime from our community. In just 3 years, Operation Our Town has helped to reduce crime, provide drug treatment and prevention programs, and much more. Mainline National Bank encourages you to be a good neighbor and take back our neighborhoods. Go to wearecentralpa.com to find out how. Mainline National Bank, your good neighbor bank.
Ladies and gentlemen, I'd like to introduce you to Terriann Grove from Contact Altoona. Terriann, welcome.
Thank you for having me, Dean.
Bright, smiling face. Boy, it's a good day for both of us, isn't it? Tell me about Contact Altoona, Terriann. What happens here? Who do we contact, and what is Contact Altoona?
Certainly. Contact Altoona is a community helpline that's staffed solely by volunteers. We've been in the Blair County community since 1982, so we have a long-standing history. Our mission is to respond to the needs of individuals through active, reflective listening, and when appropriate, we make referrals to the needed services. Our goal is to enhance personal independence for the caller and their quality of life through talking with them on the helpline.
That's wonderful. What needs, it must have been some special needs came up that somebody said, we need a helpline here. Can you help me with that history?
Certainly. What was happening in the early 1980s is there was folks who were reaching out in our community and had nowhere else to turn. They were looking for resources, someone who would allow them to tell their story, to help them make it through their particular struggle in the day. And Contact Altoona had responded to that need. It's a confidential, anonymous place whom anybody can call 365 days a year and reach a caring, dedicated volunteer who's ready and willing to help.
Except for my fear of the aging process, what other situations would cause me to call Contact Altoona? Can you give us some specifics?
Sure. We receive calls from a variety of individuals and reasons for calling. Last year we responded to over 24,000 calls on the helpline. Individuals may call, it's a single mother looking for child care that will allow her to continue to be employed and work in our community. Individuals seeking assistance with mental health issues, drug and alcohol, Maybe it's a father who's recently been unemployed and needs help paying his heating bill so that he can stay on. We maintain a database of resources, and we're able to connect them to the agencies to help get the help that they need.
The database, that's kind of interesting. What are those different treatment programs that I might be referred to through the database?
Our volunteers use what's known as the Help Resource Directory. It's established by the Blair County Human Services Office, and individuals can access through the internet at any place, and you can search by agency or by service need. And specifically with our work with Operation Our Town and our grant, we were able to identify the licensed providers who can assess and provide treatment for individuals seeking those types of services.
If I called Contact Altoona, would I be talking to a person right away?
Most certainly. As soon as the phone rings, we answer, "Hello, Contact Altoona." We do not ask for any identifying information from the caller, so it is completely anonymous and confidential, and you can call with any reason for calling.
Wow, so if I had a problem and it was really immediate, I call up, I don't have to press 1 and press 2 and press 4. I'm actually going to talk to somebody that's going to help me right away. And that's happened 24,000 times in the past year.
That's right.
Wow, a pat in the back to you.
Oh, thank you. It's
Tell me
due
about
to our
the
volunteers.
Well, yeah, and our town. Tell me about the process, though. Once that person answers the phone for me, tell me what the process that I would go through. What happens then?
Well, the caller has an opportunity to tell their story, to explain the situation that brought them to calling. We listen in a non-judgmental, reflective way that hopefully by the end of the call, the caller has the insight as to how to resolve their problem. We're not there to give advice or to solve their problems for them, but it's through the caller's working that it happens.
And specifically, what services would I be advised to go to if I were talking to somebody?
Well, it would depend on the need for the call, for the reason that have brought you to calling, whether it was a mental health issue, or if it was a child care issue, or just perhaps maybe you were just lonely and just needed to know that there was another person out there who cared. And that's also what happens in our helpline.
Does everybody on your helpline have a nice, soft, soothing voice like you do? I know that may sound, but it's a compliment. You sound like you're in control. And I think if I had a real problem, that would be very meaningful to talk to somebody who had that kind of voice that you seem to demonstrate here, unlike myself.
And I truly believe that every person in every walk of life wants to have a sense of belonging and to know that they are needed. And I think that resonates throughout all of our volunteers, and that's why they continue to volunteer and to give of their time, to know that they are reaching folks and helping them to make it through a difficult time in their life.
That's interesting, the folks, because this does involve families, doesn't it? And it involves friends and everybody that we touch. Tell me how that process works. Do you involve, if I called you with a problem, would you involve my family, or tell me how that works?
Well, I can give an example. We had experienced a call in our helpline from a mother who was looking for services for her son. She had just found out that he was having trouble with addiction. So our volunteer was able to talk with her, give her a chance to tell her story, and later in speaking with the provider who we referred her to, we found out that not only was the son now in treatment, but the mother was also receiving services and supports. So the intention for the call might be for a family member, but we're able to also help the caller at the same time.
I know that Operation Our Town reaches out to a lot of different groups. Why is your group, tell me how your group is different from other groups that are involved with Operation Our Town. What makes you unique?
We are unique in the sense that we're not a treatment provider. We had realized that of the 24,000 calls that we have received, that only 9 of them were from individuals seeking assistance with addiction. And so that made me realize that we're not reaching the population or community that can really use our services, because it is known that if an individual reaches out for help, and if they are engaged, and if they have hope and they get connected to services, then they're more likely to continue on. So we're hoping to be that first step in the process to let them know that there is somebody out there and that help is available.
As I'm sitting here thinking about what you're saying, this must go beyond the reaches of Altoona proper and maybe Logan Township. What is your service area for Contact Altoona?
We are in Blair County.
Okay.
Is our primary service area. However, we have had individuals let us know that they were calling from another state, that they had found our helpline number on our website and that they were reaching out, and we do respond to those calls. It's not strictly limited
So
to
this
Blair
just
County.
isn't geographic. If somebody calls for help, they're going to get help regardless of where they live.
That's right.
That's wonderful. How about the confidentiality? I'm sure some of these problems must be quite embarrassing to a family member, to know that another family member's. How do you handle the confidentiality?
That is a core component of our program. All of our volunteers are well trained in confidentiality requirements and follow the same confidentiality requirements as a licensed provider or treatment provider would. And as I had said, we do not ask for any identifying information unless it's completely necessary to do that, to intervene on the caller's behalf. But it is 100% confidential.
That's wonderful. I guess I've lived here most of my life, and I certainly haven't appreciated the kind of things that go on behind the scenes, so to speak. I hope more people are aware of these opportunities, because I do hear people with problems, and it's nice that they have somebody to go to. Tell me about the benefits you've received from Operation Our Town to your organization.
Well, certainly we know that our message is getting out there, that we are reaching folks, because within a 3-month time frame we've already have overextended our calls that we had responded to in the previous year. So just within 3 months, we've already reached the number from the previous year. And we're hoping that in the next quarter and the following quarter that we'll continue to have that success and help folks get the help that they need.
That's wonderful. I'll tell you what, this, Terriann, I was looking in the internet and I saw this statement from your organization, and I'm going to read it because I don't trust myself not to say it right. We at Contact Altoona share these sentiments. This is where we grew up. It's where we call home, and it's where our children are growing up. Boy, we so often forget about the children. Do you ever get calls from young, I'm going to say anybody under 18, do you get calls from young people?
Certainly we do, and we are available to anyone, regardless of age, background, socioeconomic status. We are there and willing and ready to respond.
That's wonderful. And tell me about your commitment to this. I mean, it sounds like how long have you been involved in it? How did you get involved?
My career in the mental health field had started actually while I was in college in 1996. So I guess I'm kind of dating myself there. But I really believe in each person has the opportunity and the strength within themselves to carry on in life and to make it through life's difficulties. However, sometimes you need a little support to do that. A caring voice, somebody who can say, you know, I understand what you're saying, and to be there in a non-judgmental way. And that's where my passion is to let folks know that they're not alone. We live in a very fast-paced, sometimes isolated society, and by simply picking up the phone, you can reach somebody and know that someone cares.
That's wonderful. How many employees do you have in your organization?
We
I
have,
guess some of them are volunteers,
right.
Is that correct?
Yes, our agency is staffed by 2 full-time employees, myself and our helpline coordinator, and then we have 60 volunteers who respond on the helpline.
60 volunteers. Well, that explains why you can take 24,000 calls.
Right.
How many of those calls are actually drug and alcohol, or things that you can identify and say this is a specific drug problem, how many would you say that 24,000?
Well, and those numbers were from the previous year. We had received 9 calls.
Okay.
However, within 3 months of starting our community awareness campaign, we have already exceeded that by trifold. So we're already past our 9 calls.
Terriann, it seems like Operation Our Town, when I think of Operation Our Town, primarily I think of drug and alcohol. Mm-hmm. But 24,000 calls covers the entire spectrum. Mm-hmm. So when these people contribute to Our Town, they're helping people that might have mental health problems or some other problems. And this really is reaching out into the community, isn't it?
It certainly is. And addiction might be the primary concern identified when the individual is calling. However, they might have housing issues, employment issues, and so forth. So we're able to help engage them into the treatment provider standpoint, but also let them know that there's resources out there to help.
How does one become a volunteer?
Truly, you simply need to have that desire to want to make a difference in someone's life. We provide the free training. It's done by professionals in our community. And once you're fully trained, we get you right on the helpline and get you going. So
that's wonderful. Mm-hmm. There must be times at night when you go home and feel very gratified that you've reached out and helped someone.
Mm-hmm. It is a very rewarding experience.
That's terrific. Terriann Grove from Contact Altoona, and a wonderful asset to our community. Thank you, Terriann. It's been a pleasure talking to you.
It's my pleasure. Thank you.
Yep.
Be a good neighbor. At Mainline National Bank, that means helping a neighbor financially with their business, home, or child's future. At Operation Our Town, it means taking back our neighborhoods by eliminating drug use and violent crime. That's why Mainline National Bank supports Operation Our Town. Operation Our Town's mission is to facilitate partnerships between community and business, to fight drug use and crime through proven law enforcement, treatment, and prevention techniques. It was a dramatic increase in violent crime and drug use that brought about the formation of Operation Our Town in 2007. A group of concerned business leaders gathered to discuss how to address these mounting issues. What they discovered was most organizations, including law enforcement, did not have the resources needed to deter and reduce the criminal stronghold on our neighborhoods. Within a few short months, dozens of local businesses committed financial and other support to take back our neighborhoods. Partnerships were forged between Operation Our Town and existing organizations with proven law enforcement, treatment, and prevention techniques to address these areas. Since 2007, over $1 million in grants have been awarded to local organizations. Drug arrests have increased by 30%. Calls to push out the pusher have increased by 47%. And overall accidental drug overdoses decreased by 37%. But much more needs to be done. Mainline National Bank encourages you to be a good neighbor and go to wearecentralpa.com to find out how you can help. Volunteers and financial support are needed to continue this fight to take back our neighborhoods. If your organization would like to partner with Operation Our Town, or if you know of someone that needs help, go to wearecentralpa.com and click on Operation Our Town to learn more. Mainline National Bank, your good neighbor bank.
I'm here with Nate Germany from Crossroads. Nate, it's a pleasure to see you.
Thanks for having me,
You're a good-looking guy with a big smile. Life must be treating you good.
Yes, it is. Thanks for having me, Dean.
You're welcome. Glad you're... Tell me about Crossroads. What is Crossroads?
Well, Crossroads is a recovery clubhouse which holds NA and AA meetings and a lot of the other anonymous meetings as well. So, I mean, we're there for the community, and you can come into the Crossroads if you're seeking help from drugs and alcohol.
Now, you said AA, Alcoholics Anonymous. I'm familiar with that. The second organization was?
Narcotics Anonymous.
Narcotics Anonymous.
Yes.
And that operates similar to Alcoholics Anonymous?
Yeah, they're similar, but they're different. One deals with, Narcotics Anonymous deal with drugs, and Alcoholics Anonymous deals with alcohol.
Okay, and what prompted Crossroads into becoming this is like an umbrella organization, a club for people who need help?
Well, the Crossroads was formed in 1991, and in 2011 we'll celebrate 20 years. What prompted the Crossroads to become in existence is because there was a great need in this town for people who was looking for help to deal with their drug problems and their alcohol problems, and the Crossroads was formed to hold meetings there at the Crossroad, and also the Crossroad was formed to have a safe environment for people who sought help from drugs and alcohol.
Nate, is Crossroads a physical presence, or is it just a club? Is there a place where they meet? Like, do they have a building, a room? What do they do?
Yes, the Crossroads we call it the club because it's a big building, and we have AA, which is Alcoholics Anonymous and Narcotics Anonymous meetings there, but also it's a club that you can join like any other club. We have membership dues, and we have we have a variety of memberships, at different costs. But we also have it's a club that opens from 10 a.m. to 10 p.m. 7 days a week, and you can come to the club and just hang out there. And a lot of people like to hang out because it's a safe environment away from drugs and alcohol.
Now, is this confidential, this location, or can you disclose the location to us?
Oh, it's not confidential, but the people that attend our meetings, they would like that confidential, but the clubhouse itself is not confidential. The Crossroads is located on 827 19th Street, across from the Driver License Center.
Hey, would you repeat that so everybody because that's important they know where it is. Tell the audience where that is again.
Okay, the Crossroads the address is 827 19th Street, Altoona, PA, right across from the Driver License Center place.
That's wonderful. And if I were I could walk in there even though I'm not recovering and just walk in there and enjoy myself if I needed a place to get away.
Sure. A lot of people come through there to just hang out. We have a lot of different things that we do there, but sure, if you wanted to come in, you could. And the thing about it is, though, you probably couldn't come if you weren't a member of one of the groups. But when the groups aren't going on, sure, anybody, the public, can come.
Okay, and that makes sense. When you're having confidential meetings, you don't want people just wandering in and out, and that wouldn't be fair to the participants.
Right.
Tell me, there's a lot of treatment programs out there, specific levels. Can you tell us a little bit about the treatment programs and things that are involved in this?
Mm-hmm. Well, a lot of times, some of the treatment programs is we have rehabs, we have inpatient, we have outpatients, which inpatient and outpatient deals with drug and alcohol. The inpatient would be a facility, a rehab, where you would stay there overnight. They would treat your disease, and after 28, 30 days, they would release you. There's also an outpatient treatment program, whereas though you don't go in there to stay, but you attend the outpatient program, and you would go home. So you would attend the outpatient whenever you were scheduled to, but you wouldn't stay there, you would just go home. Also, there's another type of treatment is called is mental hospitals and hospitals. So a lot of people who do drugs and alcohol suffer from mental health problems, so the mental hospital would help them out in that area. Now, the other treatment thing is, what we do at the Crossroads, which is our AA meetings and our NA meetings, and that's another treatment. So that's where the Crossroads will come into play at.
The process of recovering, I sense, could be a very lonely one. Is there some way that you get the families involved, or how would a family get involved in this recovery effort? Mm-hmm.
There's a group out there called Al-Anon group. Okay, and what Al-Anon does is they deal with family members who suffer from drugs and alcohol, either a family member that's on drugs or alcohol, or maybe they're on drugs and alcohol and they need to find out better ways. But that group, Al-Anon, is also anonymous, and a lot of family members go to that so they can understand how to deal with their family members that suffer from drugs and alcohol. And also it'll give them a better aspect on, you know, how the disease of alcoholism and drugs affects them as well.
Earlier in the program, Judy Rosser from Drug and Alcohol, we talked about enablers. Mm-hmm. And is that what happens? Is sometimes family members become enablers without even realizing that they're not helping? Is that possible, Nate?
That's definitely possible, because a lot of family members who's dealing with their children or they want to help their family. They don't want to just shut the door on them, and because they don't understand everything there is to know about addiction and alcoholism, they help their family members, and what happens is they become enablers, and a lot of times that's not good, because the alcoholic or the addict has to like hit a bottom where they will say, okay, I need help, you know, but with their family members keep helping them, you know, instead of showing tough love, the person that's in treatment really doesn't really get clean or sober, because his family is always helping him out.
And you're the president of this organization, Crossroads?
Yes, I'm the president of the Crossroads.
That's wonderful. And how does our town help your organization, Nate?
Operation Our Town has been very helpful with helping the Crossroad, along with Blair County Drug and Alcohol. You talked about Judy Rosser. Yeah. She's been tremendous in helping us as well. We recently received a grant from Operation Our Town, and they like made over the whole club. You know what I mean by that is that we were able, through Operation Our Town grant, purchase, along with Blair County Drug and Alcohol, big screen TV. So we have big screen TV, a 56-inch plasma. We were able to purchase 4 brand new computers. We were able to purchase a pool table. In our pool table area, we was able to purchase another small plasma TV that goes down there. We have a few rooms in the Crossroad. We was able to put all new rugs in each room, as well as new furniture in the rooms as well. We were able to upgrade our literature as far as our Alcoholics Anonymous literature. They've helped us out a lot.
That's wonderful, Nate. You must get a great feeling. You're president of the organization. Do you get to see success stories? I mean, do you get to see people coming through these programs?
Yes, it is a joy to see someone come through the program, fresh out the streets, and you know, not being able to. I mean, I've seen people come in that can't even speak that well, and a few months in the program, they gain their voice back, they gain their strength back, they gain their confidence back, and it's a real joy to see someone get better.
Tell me about yourself, Nate. You seem to have a passion for this. How did you get involved in the Crossroads?
Yes, I definitely have a passion for the Crossroad and for recovery in itself. I got clean in 5/25/06, which is May of 26, so I celebrated 4 years clean. And I don't know.
Excuse me, Nate. I just need to take a second here and applaud your efforts.
Thank you. And what I did was I hung around the club, and I started off as a secretary, and I just hung around the club, and someone mentioned to me, why don't I run for president? And I did, and that's where I'm at right now.
What a wonderful commitment. What a way to give back to the community.
Yes.
And you actually were a participant in these programs, so you know what people are going through.
Yes, definitely.
Was your family there for you? Did they help your family get close to you, Nate?
Definitely. I mean, once I started to get clean, and everything started to work out, you know, I started praying, and I started to live my life a little bit differently, well, a lot differently, and my family they seen that, and they've been very helpful to me and very supportive in what I'm doing.
Well, you're a good-looking young man. You must be a great role model for some people out there. Do you do much speaking out in public and telling people, spreading the message?
Yeah, well, yes. One of our duties is to spread the message of both programs. I don't know about role model. The program really teaches you to be humble and to thank God for everything. And you know, I remember what it was like before I got clean, and I know what it's like now.
Nate, forgive me. I get a little emotional because when I see a success story such as yours, and you realize what the alternatives were and how much it means to our community for people like yourself, you can still be humble and share your message with young people that need to know there's hope out there. This is our home and this is our community, and the children out there need to know that there's hope.
Yes.
We all have problems daily. And suddenly it may seem very black, but the fact is that you're there to bring some light into their life. That's you must feel very good at the end of the day.
Yes, I wouldn't really, you know, I don't know, I'm pretty humble, and, you know, it's hard for me to say that, you know, they look at me for success, you know. I wouldn't say that, but thank you for that. You know, I really appreciate that. You know, the program is great. It just teaches you to be humble and
thank you, Nate.
Love God.
We're talking to Nate Germany from Operation Crossroads, and a fine young man. Thank you very much, Nate.
Thank you, Dean.
Pleasure talking to you.
Thank you, Dean.
Be a good neighbor at Mainline National Bank. That means helping a neighbor with their business, home, or child's future. For Operation Our Town, it means eliminating drugs and crime from our community. In just 3 years, Operation Our Town has helped to reduce crime, provide drug treatment and prevention programs, and much more. Mainline National Bank encourages you to be a good neighbor and take back our neighborhoods. Go to wearecentralpa.com to find out how. Mainline National Bank, your good neighbor bank.
Well, I'd like to welcome back to the show Judy Rosser from Drug and Alcohol Abuse, and Nate Germany from Crossroads, and Terriann Grove from Contact Altoona. After our discussion, it sounds like this is like a process. I guess the process starts with you, Terriann, am I correct?
Correct. At Contact Altoona, our helpline number is the number for folks to call when they're seeking assistance and help with addiction, and we're able to get them connected with services.
Give us that number.
946-9050.
I hope everybody wrote that down. Give it to them again, because they didn't get a pencil yet.
Sure. 946-9050.
Okay, so the person has called you and you've recognized the need, and now you're going to send them to a second level, which may very well be Nate's group. Right, Nate? Now you get the call that somebody needs help, and then your process starts.
Right. A lot of times when maybe a person has been arrested and they might have committed a alcohol or a drug-related crime, a lot of times the judges will refer them to, they'll attend meetings, AA, which is Alcoholics Anonymous, or NA, which is Narcotics Anonymous. And we're like the first places they come once they get released from jail.
And Judy, you kind of umbrella the whole thing, is that correct?
Right. Yeah, part of our job is to look at what's available in the community to address it. Like you were saying, people in early just deciding they want to get some help, knowing where to call, where to turn to. Contact Altoona is that place where they can call, that one number that's available 24 hours a day. They can talk to somebody, and then they can give them the resources that are available in our community. Then they can call, make contact, be evaluated for what their issues are, what kind of services they may need, and then of course the Crossroads services that are available for those individuals that are in early recovery. It's hard. It's isolating, because one of the things you tell people to do when they first come in is you got to change people, places, and things, because they're going to drag you right back into substance use. So think about that. Think about how isolating that could be for somebody to lose that network, no matter whether it was a negative network or not. They were connected to people, and you still want to be connected to people. That's another place where Contact can help out too, because they have some place they can call. But definitely Crossroads. There's people there that know what walk they're on. They can talk to them. They can help them with those first steps into recovery. They can help get them connected to the recovering community, which is so important. And we do have a strong recovering community out there. There are people recovering, and that is what's, a message of hope that we need to say out, that it is happening in our community.
Now, you're the president, and you're the director, and you're the director, and how do you communicate with each other? When do you communicate with each other?
I communicate with Judy and her staff and her organization a lot. Matter of fact, one of her staff members attends our board meetings once a month. And as far as the hotline, a lot of times I know the hotline will send them to us as well. So we communicate.
I'm lucky. Because of what my job is, I get to work with both of these individuals all the time, which is a blessing. Terriann actually sits on my advisory council currently, who sits to advise me on what's happening in the community so that we can do good planning. And like Nate said, we've been very involved trying to help support the Crossroads efforts to keep those doors open, because it's very important to have that place where people can go to reconnect and develop a new network of support once they've tried to walk away from the old people that they've been running with.
Now, you've each been involved for a rather lengthy amount of time in terms of today's 7-second time attention spans. When I sense that Operation Our Town is a relatively new organization, did any of you help in the formulation of that group, or tell me what role that played in this overall thing? Let me start with you, Judy.
I wasn't part of the formulation of it, but I do currently sit on their steering committee, and I also attend several of the roundtables. I'm on their pharmacy roundtable. I'm on the Northern Blair County roundtable. I also, like I said, I am on their steering committee also.
Nate, you had to be happy when you heard that there was some organization here that was going to think about, hey, we need to pay attention to this.
Yeah, the Crossroads, Operation Our Town has been great. They, a lot of times they'll have an open house for different things, different areas in recovery they think we need to go to, as far as workshops, things like that. And so they'll invite me from the Crossroads and maybe some of our other staffs, and we're able to learn a little bit more how the Operation Our Town works. But in general, I didn't have anything else to do with forming Operation Our Town.
But you were happy to see it being formed.
Definitely.
And Terriann, how about you?
Operation Our Town is very committed to Blair County, to improving our community, and it is inspiring, the work and that happened behind the scenes with the businessmen who had started Operation Our Town, and their commitment to improving overall.
I have a sense the community education portion of this Our Town, the fact that these business people are now involved, as you said, I will confess I was in the business community, and we were kind of isolated from those neighborhood problems that you seem to deal with every day. And now we're aware of it. And not only are we aware of it, but it seems the community's more aware of it. And that's wonderful. I just don't know how to say thank you to each of you for a terrific job. Tell me, I keep hearing about these lines where you call and report. Is it called Push Out the Pushers or something? Who is that part of your group?
No,
it's not.
Okay.
That actually was started from Blair County Youth for Drug-Free Communities, which is another coalition that's been very active in our community since 2000. And that back then we had a federal grant to help support the Push Out the Pusher. It was a time when we were seeing a real strong push of people from outside of our area bringing drugs into our community. Drug dealers were coming in, and so we really wanted neighborhoods to start to get involved because we knew the police forces are only infinite in what they can do. There's only so many staff that they have, and the more eyes on the problem, the better off we are. So actually, Push Out the Pushers started then. We had lots of campaigns going on, but we were losing federal money, and we really needed it to be picked up and used by businesses as part of their advertising budget if they could get on board and really look at it. And that's at the same time Operation Our Town came on board, and they took it and ran with it, which was wonderful because they've taken it to that next level which it needed to go to.
That's wonderful. Terriann, if you wanted the community to know one thing about your organization, what would it be?
A caring voice as close as the telephone,
Oh, boy.
I would say.
How appropriate. A caring voice as close as your telephone. Wow. Judy, how about you?
That there is help out there. That we're ready. Our system is available. There is funding right now. A lot of times we get a lot of rumors out there that funding's been dried up. I've never run out of money till the end of the year. I've always had some level of services. It may not be at the level that everybody needs, but we do provide some type of treatment so that people can get into services. So that would be my message. Please call if you need help.
Nate, how about you?
The Crossroads and along with our meetings that we have there is a proven program that works. If you ask anybody like how they stay clean and sober, they'll tell you that they attend meetings and they work the 12 steps. And in turn, what it helps the community out because there's probably less crime and the neighborhood looks a little bit better.
Yes, Judy. Did you?
I was just going to say that I think probably the number one people in our community that want to see a drug-free community more than anyone would be our recovering community, because they know the better off the community is, the stronger and the more connected in their recovery they can be also. So it's a really important thing from all levels.
What a pleasure this has been for me. What an eye-opening experience. I'm so glad I was here. Terriann Grove from Contact Altoona. Give us the phone number again, Terry.
946-9050.
Because I don't want you to forget that. These people need all the help. Judy, how about you?
Judy Rosser, Blair County Drug and Alcohol Program Incorporated, and our number is 693-9663.
And Nate?
Nate Germany, the president of Crossroads. Our phone number is area code 814-330-8197, and we're located across from the Driver License Center in Altoona.
Okay. These people are able to do the work in our community, folks, because of people like you. We need your help. Thank you.
Thank you.
I would say that the big pieces of our lives are connected to our ego and how it is working in our lives. And if one isn't happy with where their life is, if it's not being fulfilled in the way they would like it to be, I would suggest that the first place they look is their ego and to understand it more.
Awesome. Okay. Thank you all for tuning in. And let's see. So the next thing we got tonight is a radio show. It's from 8 to 10 Eastern Daylight Time. And if you like, you can log into the website at www.universaltalk.info. We'll be discussing a positive human future with President Dwight D. Eisenhower's great-great-granddaughter, Laura Eisenhower. And of course, I want to thank you all for tuning in to our show. If you like the show, dislike the show, any other questions or suggestions for future content, email me at universaltalking@gmail.com. Or if you missed the show or some of the show and you'd like to listen to the content, simply log on to my website at universaltalk.info. And this is Joe Morris signing off for Universal Talk.